How are you?
I'm doing good. I'm doing good.
So you still...
It was a referral from the plastic surgeon that I had used in Sherman, Texas. Actually contacted and inquired and found Dr. Cheng and referred me to him because he said he was the best in the business to do this type of surgery. I have a connective tissue disease and I have some tendonitis in all of my joints because of it. And this started with as simple as trying to open the door. One day I just went to open the door and I couldn't turn. I didn't have the strength to turn the doorknob and open the door. And the pain was tremendous, and it just kept getting, the joint just kept swelling bigger and getting more painful. And then it got where, like I said, I could just move my thumb and it hurt just to move my thumb. And it would get catches because the bones, where the joint was gone, the bones actually laying across each other and rubbing back and forth every time I used my thumb, which was very painful. I didn't know what it was. I just thought that I had inflammation in the joint. I had no idea that the joint had totally disintegrated, which is what Dr. Cheng told me on the x-ray. Immediately when he looked at my x-ray, he immediately told us that arthritis had totally eaten the joint away. He immediately knew when he looked at it. I was a little surprised because I had no idea what they were going to do. When I came, someone had said, well, they'll put in a titanium joint. You hear about joints in the knees and the hips. So I was expecting them to put in some type of prosthesis. And when he told me he was going to take out a tendon, I'm thinking, well, how are you going to use a tendon? And he explained that it calcified and made a better joint than even my own joint, and I would have better use and strength in my hand than I had when I came in. And he's right. I can do all the things that I couldn't do before. So I'm very pleased. This is the joint. They cut they cut one of the bones off. Then they took a tendon from here. I have 2 incisions here where they took the tendon. And then he made the joint, and they just glued these. I didn't even have to have stitches, and then put stitches in this. I had this surgery on June the 8th. So it's been most of the summer, about 2.5 months. So it's a long process, but I have a connective tissue disease, which makes my healing a lot slower than a lot of people's would be. That's what he was saying, why he had me wear the brace a little longer than most people to make sure it was healed. And I had 2 different casts that I had to wear a cast for 6 weeks afterwards and couldn't use it at all. So it was a long process, but well worth it. Well, the pain was very short-lived for the number of years that I've put it off having it done, because I just didn't want to go through the surgery. And it was not bad. It was not anywhere near as bad as I thought. You see people that have their joints removed and they have months of physical therapy, and some better, some not. This was better, no therapy. It healed on its own, and I've been able to use it, and I have been thoroughly pleased with the experience. They've been very nice and accommodating, and I have no problems at all. He's a very nice man, very gentle, very kind. The staff is very nice and comforting, and they're just generally make you feel comfortable and at home, and you can feel like you can ask whatever you need to ask. And if you need to call, you can feel free to call them and ask them questions if you have a concern. And they're there to listen to you.